Hi everyone, it is Dr. Thompson here, and today we are going to talk about everyone's favorite topic, poop. It's something that a lot of people do not like to talk about, but it actually can give us a really, really good insight to what's going on in your body and what's going on with your overall health. So, a lot of people think that going to the bathroom a few times a week is normal, but that is actually not normal, and constipation has kind of become the new normal in America. 42 million Americans suffer from constipation, gas, and bloating. That accounts for 2.5 million doctor visits each year. And the AMA will consider constipation less than 3 bowel movements per week, but I like to consider constipation less than 1 bowel movement per day. You really need to be going to the bathroom every day so you can get what you're detoxing and get any toxins out of you. You should have a stool that's soft and formed like a banana. It shouldn't be little chunks. It shouldn't be loose. It shouldn't be really hard to pass. All of those are abnormal. So it should be soft and formed and every day. The color of your stool tells us a lot. It tells us kind of either what you ate or what's going on inside of your body. So the normal color of stool should be a color of brown. As your stool passes through your GI tract, as it passes through the gallbladder and the bile ducts, it's going to pick up bilirubin, which is the main chemical of bile, and that is what gives it that brown color. And so it should not have large undigested chunks of food. It should just be a smooth banana formed stool that's fairly easy to pass. As you can see on the right, we have the Bristol stool chart, and this is kind of a good indicator to see what's going on with you. As you can see at the top, those are more of the constipated stools, and then as the bottom is more of the diarrhea and inflammatory stools. You really want those number 3 and number 4 just formed and not too hard to pass. So color-wise, if you see an odd color in your stool, you have to first think, what did I eat? So if you have a red stool, you have to think, did I eat beets, hot Cheetos, cranberries, red velvet, licorice, something that has a really strong red dye to it. If you didn't eat something with red dye, then it may indicate something like a GI bleed or hemorrhoids. When I was younger, I was on this beet kick, and I drank all this beet juice, and I had ironically taken a fall on a bike. And the next day I went to the bathroom and I noticed what I thought was bleeding. So I rushed to the hospital, and the first thing they asked me was, have you had beets or hot Cheetos? And I was like, yeah, I've had a lot of beets. And I had to embarrassingly walk out of the hospital knowing that I wasn't bleeding. I didn't have any internal damage. I had just eaten too many beets. So if you haven't eaten any beets or anything red, then we think something more of a lower GI bleed. The reason it's a lower GI bleed is if it's up higher, the blood will turn black. So this is something low, something right towards the exit, right towards the surface. Will give it that red color. What if your stool is white and chalky? This can indicate a blocked bile duct. We talked about the bile duct a minute ago, and so the bile duct is responsible for moving bile, and this is what breaks down your fats from the liver to the gallbladder. And if there's a blockage in the bile duct, you're not going to have bile, which isn't going to have the bilirubin, which is going to have the brown pigmentation. So you're going to have a white, a lighter, a chalky color stool just because there isn't bilirubin. If your stool is black, first think, what did I eat? Did you have black licorice? Did you have charcoal? Or did you have a medication, a bismuth medication like Pepto-Bismol? Will or can turn your stool black. If you ruled out that you ate anything, then it would be more of an upper GI bleed, just because as the blood has to travel down, it will clot and turn black. What if your stool is yellow? This may indicate that your body is not digesting your fats well. So if your body isn't digesting fats well, you may also notice the stools float in the toilet. Your stools really shouldn't float, or they shouldn't sink. They should kind of just be halfway. But if you're not digesting fat, you may notice that they're floating. Greasy or yellowy stools may also indicate that you're not absorbing your nutrients well, and can be a sign of conditions like celiac, lactose intolerant, or irritable bowel disease. So all of these would require further testing, further symptoms, but can indicate those. This is always a question we get. Should my poop smell? And the answer, yes and no. So normal stool will have a slightly unpleasant smell, but it should never be foul smelling. You should never, walk out of the bathroom and someone's like, oh my goodness, that's horrible. So it shouldn't be foul, but it can have an unpleasant smell. Foul smelling stools can be an underlying infection. And so the infection can be bacterial, fungal, or even a parasite. And sometimes you'll get like a burnt rubber smell, or just a really horrible, it sounds like smells like somebody died smell. But the burnt rubber one is usually a bacterial infection. And usually if you have infection, you're going to have some other symptoms. You're going to have constipation, bloating, diarrhea, food cravings, skin problems, something along those lines, usually. Sometimes not, but usually there's other symptoms. Lactose intolerance and celiac may also give you foul-smelling odor. So if you think lactose intolerance, then start to keep a food journal and try to journal and see if your foul-smelling stool and eating dairy coincide. If you suspect celiac disease, you can also keep a journal and see if there's any other additional signs. This is going to have your yellow, greasy stools, and you may also have changes in your weight and bloating. So you'll want to see if these correlate to eating wheat to see if it's of celiac disease. So what should be in your stool? So undigested foods are usually not a red flag if they're not happening all the time. So there's certain foods like corn, nuts, beans, leafy greens. They're really, really high in fiber and they're hard to break down. So you may see those in your stool. That's completely okay. If you eat too quickly, this may also cause undigested foods. If you're like me and you're always eating on the run, this may cause your food just to not be properly, chewed at first and then not properly broken down. So you may see these foods in your stool. You may also be able to see different infections. Candida is notorious for showing up in stool, and it kind of looks as though like a white string cheese, frothy substance in your stool. So that can indicate candida. So definitely what's in your stool can help you identify what's going on. Also, if you see biofilm, that can indicate signs of infection or parasites. And biofilm is a slimy substance that infections will produce to protect themselves from our immune system. Basically makes a little house for them in our gut where our immune cells don't even know they're there. And so if you pass biofilm, you may need to do some more work and really get the biofilm out of you and work on the infections that are housed in the biofilm. So there's some foods that will help you build a healthy gut, help you go to the bathroom regularly. Leafy greens. Having lots of greens will definitely help push your stools through, give you lots of fiber, and will also, give you tons of vitamins and minerals. So 3 cups a day is minimum. I eat a big bed of leafy greens with every meal. High fiber foods, apples, raspberry, artichokes, these are going to help you bulk up your stool, help it move along. And low glycemic vegetables also, broccoli, cauliflower, squash, zucchini, all great. Lots of minerals, lots of vitamins, and will help bulk up the stool. Chia seeds, bone broth, fermented foods, healthy fats, and raw garlic all are going to help you build a healthy gut. These are all really great superfoods that will help you have a healthy gut, and a healthy gut means healthy stool. Supplements that will help you support healthy bowel movements. This is going to be psyllium husk, cod liver oil, your omegas, magnesium, aloe vera juice. I just put aloe vera juice in with my tea in the morning and use it like I use cold water to cool down the tea, and beet juice. So as you can see, there's a lot of ways that we can look at your overall health through your gut. If you ever see any of those colored stools and they're not because of what you ate or you're thinking infection, I would definitely go find a practitioner that can help you get it checked out for something more serious. But I encourage you to, take control of your gut health and use your stools to help you navigate what's going on in your body. I hope you guys all have a great day, and we will talk soon.